Hi guys, and welcome to our model on the species of the upper limb. In this model, we're talking about all the important species of the upper limb, starting with the axilla, then talk about the cubital fossa, the carpal tunnel, the anatomical snuff box, and we'll also make mention to a few species that are not so common, not so high yield, but is worthy of mention. One of the very important species of the upper limb is the axilla. The axilla is typically known as the armpits in colloquial terms. It is a truncated pyramidal shaped space found at the junction between the arm and the upper thorax, and it tends to be found just directly below the shoulder joint. What is very key to note about the axilla is the fact that it contains a lot of neurovascular structures. So there are nerves and there are vessels found within the axilla. These are very vital structures. Damage to structures or damage to the neurovascular structures within the axilla could be detrimental. You could have bleeding, hemorrhage occurring. You could have damage to nerves and eventually paralysis of different muscles of the upper limb. So this is just a picture showing us the axilla. The location of the axilla, like I said, is between the arm and the upper thorax. And though it's not shown in this picture here, but when we get to see the boundaries, you would get to appreciate the truncated pyramidal shape of the axilla. What are the boundaries of the axilla? The axilla is made up of multiple boundaries because it is pyramidal in shape. It would have an apex, a base, an anterior wall, posterior wall, lateral, and medial wall. So it practically has the four-sided shape of a pyramid alongside the apex, which is the pointed upper end, and then the base, which is the floor. The apex of the axilla is formed by a combination of multiple structures. So it's formed by a combination of the first rib together with the scapula, the superior part of the scapula, and the clavicle. These three structures will come together to form the apex. The apex is truncated, meaning it's not a pointy part of, it's not a pointy uh, structure of the axilla. The apex is not pointy, rather, the apex tends to have a bit of truncation. The truncation that we see in the apex is as a result of the formation from those three structures I just mentioned. This truncation of the apex is usually called the costoclavicular canal. So when you're about the costoclavicular canal, just know that we're referring to the apex of the axilla, and that is formed by the three structures: the first rib, the superior part of the scapula, and then the clavicle. The floor of the axilla is formed strictly by skin and the axillary fascia, and it's one structure that we tend to touch whenever we are touching our armpit. The part of the armpit that we touch tends to be the floor of the armpit. The other part of the boundaries of the axilla are not areas that we can easily access. The anterior and posterior boundaries of the axilla are formed by a number of structures. The anterior boundaries of the axilla is formed by two major muscles and then a fascia covering them. This includes the pectoralis major and pectoralis minor muscle, with the clavipectoral fascia surrounding them. The posterior boundary of the axilla is formed by the muscles subscapularis, teres major, and the latissimus crus muscle. I'll show you pictures of each of these boundaries when we get to the slide later on in this model. What about the lateral and medial boundaries of the axilla? The lateral boundary of the axilla is formed strictly from the humerus and the coracobrachialis muscle. The part of the humerus that forms the lateral wall of the axilla is the intertubercular sulcus of the humerus. Remember that the intertubercular sulcus could also be called the bicipital groove. So in case you see bicipital groove, intertubercular sulcus, they mean one and the same thing. The medial wall of the axilla is formed by serratus anterior muscle, and that serratus anterior muscle tends to attach to the first to fourth rib and its intercostal muscles. So the structures that form the medial wall includes the first to fourth rib, the intercostal muscles that are in between them, and then the serratus anterior muscle. So this is just an image of the boundaries of the axilla that we just talked about. Remember, it's a truncated pyramidal structure that has an apex. Apex is in green here. Remember, the apex is truncated, hence it is not going to be pointy. The apex is formed by the three major structures I mentioned. Remember, it is formed by first rib, the superior border of the scapula, which is present here, and the clavicle, which is in front. So these structures give rise to the apex. Remember, the apex is also called the costoclavicular canal. So this structure in green here is the apex. The base, on the other hand, is formed by skin and axillary fascia. That's not shown in this image, but this is going to be the base in yellow. And then we have the anterior wall, posterior wall, the medial and lateral wall. The lateral wall is shown in blue. Lateral wall is formed by the intertubercular sulcus. As you can see, this is the intertubercular sulcus and the coracobrachialis muscle. Whereas the medial wall is formed by the first to fourth ribs. So if you count the ribs, this is rib 1, 2, rib 3, and rib 4. And this muscle that attaches to this first to fourth rib, the serratus anterior muscle and the intercostal muscles, which also help in forming the medial wall. And finally, with the anterior and posterior walls of the axilla are not shown here. Anterior wall is formed by two major muscle and a fascia, the clavipectoral fascia, alongside the pectoralis major and minor muscle. Whereas the posterior wall is formed by muscles, including the subscapularis muscle, the latissimus dorsi muscle, and the teres major muscle. What are the contents of the axilla? When we're talking about species of the upper limb, we talk about boundaries and contents. In terms of the content of the axilla, we have the neurovascular structures that I mentioned at the start. This includes the axillary artery. We talked about this when talking about the arterial supply to the upper limb in the previous model. So we have the axillary veins. And the neural structures that we find in the axilla tends to be the brachial plexus, for particularly the cords and the terminal branches of the brachial plexus. We talked about this extensively on our model in the brachial plexus. Alongside the neurovascular structures, we have some minor structures we find in the axilla. This includes the axillary lymph nodes, the axillary fast, and the axillary telos. We'll talk about the axillary lymph nodes when we talk about the lymphatic drainage to the upper limb. Now, this is an overview of the axilla. It shows us some of the structures we talked about, from the boundaries to the contents. Starting off, you notice that the anterior boundary of the axilla includes the muscles we mentioned, the pectoralis major muscle shown here, and the pectoralis minor muscle. The clavipectoral fascia is not necessarily shown here, but it's a fascia that wraps around these two muscles. Then at the back of the axilla, the posterior wall is formed by some of the muscles that we mentioned. As you can see subscapularis muscle here. The other muscles are not really shown in this image because they are lower down compared to the subscapularis muscle, but we have the teres major muscle and the latissimus dorsi. On the medial wall, we could see the serratus anterior muscle forming the medial wall directly attached to the ribs. So this is the medial wall. This is serratus anterior muscle, and this is the rib attached to it. And then the lateral wall is formed by the coracobrachialis muscle. As you can see, um, the coracobrachialis muscle partly shown here, partly shown here. This is part of it. And then the intertubercular sulcus at this point, it is the intertubercular sulcus. And within the axilla, you find a number of structures that we already mentioned. So you see the axillary artery here in red, all right? And just directly beside the axillary artery is the axillary vein in blue. Surrounding the axillary artery and the axillary vein is a sheet that wraps around it. That's called the axillary sheet. It encases the axillary artery and vein. And you also have some structures present here that we mentioned, the brachial plexus, the cords, and terminal branches of the brachial plexus. Remember, the cords of the brachial plexus are three in number. We have the medial cord, the lateral cord, and posterior cord. The reason why we call it medial, lateral, and posterior is because of the relationship of the cords to the axillary artery. As you can see, we have one cord being medial, one being lateral, rather, one being medial, and then one being posterior. This is showing us the cords of the brachial plexus. Aside the cords, we also have terminal branches of brachial plexus also being contents of the axilla. Alongside these structures, the vascular structures, you could also see some green looking structures. These are the axillary lymph nodes. We'll talk about them. We'll talk about the lymphatic drainage of the upper limb. So this is just in a nutshell showing us most of the contents of the axilla alongside some of the boundaries we already made mention. So second important space of the upper limb is the cubital fossa. Now, this space is found at the junction between the arms and the forearm. So it's found directly at the elbow region. The elbow is found posterior to the cubital fossa. So the cubital fossa is found anteriorly. It's a V-shaped or triangular shaped space that tends to contain a lot of neurovascular structures. Neurovascular structures running from the arm to the forearm are going to be located within the cubital fossa. Is a picture of the location of the cubital fossa. You can see it is found on the anterior part of the junction between the arm and the forearm, so just directly in front of the elbow, and it is a um, triangular shaped structure, usually an inverted triangle. The apex of the triangle is pointing downwards, whereas the base is pointing upwards, so it is an inverted triangle. Let's quickly talk about the boundaries of the cubital fossa. Because it's an inverted triangle, it's going to be having a superior boundary, a lateral, and a medial boundary, and then the apex pointing downwards. The superior boundary of the cubital fossa is formed by an imaginary line that tends to connect the medial and lateral epicondyles of the humerus. I'll show you a picture of how it looks like. Then the lateral boundary is formed by the medial border of the brachioradialis muscle, whereas the medial border is formed by the lateral border of the patellar muscle. Please do remember each of this because they could twist the questions to in a way in which it could be confusing. So remember that the lateral border is formed by the medial border of brachioradialis, and the medial border is formed by the lateral border of pointer teres. I'll show you a picture of how each of these boundaries looks like in real time. So this is the picture showing us the cubital fossa. Let me outline the cubital fossa once more. So this is the area I'm showing with the red marker outlines the cubital fossa. It's an inverted triangular shaped space. The superior border, as you can see, is an imaginary line. This is superior border is an imaginary line that connects the medial epicondyles to the lateral epicondyles. This is the medial epicondyles, this is the lateral epicondyles here. Imaginary line forms the superior border of the cubital fossa. The lateral border of the cubital fossa is formed by the medial border of the brachioradialis muscle. And I'm wiping out all the markers here to quickly show that particular point we call the lateral border. This is the lateral border of the um, or the lateral boundary of the cubital fossa. It is formed by the medial border of the brachioradialis. What do we mean by medial border? So this is the brachioradialis muscle. It has a lateral border. This is the lateral border here. And a medial border, this is the medial border. So the medial border of the brachioradialis is what forms the lateral boundary of the cubital fossa. Contrast to the medial boundary of the cubital fossa. The medial boundary of the cubital fossa is formed by the lateral border of the frontal teres. So this is the lateral border of the frontal teres here. So this is the lateral border of the frontal teres at this point, and it forms the medial boundary of the cubital fossa. So in terms of the parental teres, this is the medial boundary. It is pointing towards the medial portion. It's pointing inwards towards the center of the body. That's why we call it the medial border. Then this is the lateral bound and border of the parental teres. It's pointing outwards, away from the midline. So these two structures forms the medial and lateral boundary of the cubital fossa alongside that superior boundary formed by the imaginary line between the medial and lateral epicondyles of the humerus. The cubital fossa also has a roof and a floor. The roof is formed largely by the skin, followed by the superficial fascia, then some veins found directly beneath superficial fascia called the median cubital vein. We talked about this vein when talking about the venous drainage of the upper limb. And then just directly beneath the median cubital vein, we have the bicipital aponeurosis. So going from the most superior structure to the most inferior structure, we have skin, superficial fascia, median cubital vein, and bicipital aponeurosis. All four of these structures gives rise to the roof of the cubital fossa. The floor of the cubital fossa is formed largely by the brachialis muscle and the supinator muscle. In the image I will be showing you next, you see part of the brachialis muscle and supinator muscle forming the floor of the cubital fossa. So this image just shows us the roof. The roof you can see is formed largely by skin. Beneath the skin, the different structures that form the continuous layer of the roof would include the superficial fascia, the medial cubital vein, and the bicipital aponeurosis. Let's talk quickly about the contents of the cubital fossa. The contents of the cubital fossa are neurovascular structures alongside few lymph nodes. These neurovascular structures from medial to lateral includes medial nerve. So medial nerve is the most medial structure in the cubital fossa, followed by the brachial artery, then the biceps tendon, then the radial nerve, and some part of the cubital fossa contains sparsely distributed cubital lymph nodes. So please do remember that in terms of the contents of the cubital fossa, we have an acronym to remember each of those different contents. And that acronym is the acronym MBBR or MBBS. Usually I prefer to use MBBS because the part of the radial nerve found at the cubital fossa is the superficial branch of the radial nerve. So remember that M there stands for medial nerve, B there stands for the brachial artery, Second B stands for biceps tendon, and then the S stands for superficial branch of the radial nerve. So this image shows the different contexts of the cubital fossa. Starting from medial going to lateral, we have the medial nerve shown in yellow here, then followed by the brachial artery in red. Then the next structure would be the biceps tendon. The biceps tendon is this large brownish structure present at the center. And then the last structure towards the lateral part of the cubital fossa is the radial nerve. Remember, it's a superficial branch of the radial nerve that we see. So that's perhaps of the mnemonic or the acronym we use to remember the context of the cubital fossa, which is the MBBS. Just to add to it, cubital lymph nodes are also found within the cubital fossa, although they are not very common. The third structure we'll be talking about as part of the species of the upper limb is the carpal tunnel. Carpal tunnel is a space found at the junction between the forearm and the hand. Remember, each of these pieces are found at different junctions. The axilla is found at the junction between the upper thorax and the arm. The cubital fossa is found between the arm and the forearm, and then we have the carpal tunnel found between the forearm and the hand. And then this particular structure, what they call carpal tunnel, is found on the anterior part of the wrist joint. It is a tunnel-shaped structure that contains neurovascular structures and tendons. So please do remember that tendons are found there alongside nerve structures, passing from the forearm to the hand. The boundaries of the carpal tunnel are straightforward because the tunnel will have a roof and a floor to it. The floor of the carpal tunnel is formed largely by carpal bones. These bones includes most of the carpal bones, including the scaphoid, lunate, trapezial bone. Pisiform also forms a bit of the boundary at the edge. And then the distal bones like the trapezium, trapezoid, hamate, and the capitate also forms the floor of the carpal tunnel. So almost all the carpal bones are going to be giving rise to the floor of the carpal tunnel. The roof of the carpal tunnel, whereas is gotten from particular ligaments known as the flexor retinaculum. It's a ligament that tends to arc from the hook of hamate and um, the pisiform bone on the medial side and run all the way up to the tubercle of the trapezium and the scaphoid on the lateral side. So I'll show you a picture of how this flexor retinaculum starts and how it ends and how it forms the roof over the carpal tunnel. This is the image of the carpal tunnel. As you can see, it is formed by the floor. It contains the floor rather formed by the carpal bones. You can see all the carpal bones giving rise to the carpal tunnel, and then it's formed by the roof, or which is composed of the flexor retinaculum. So this is the flexor retinaculum. A flexor retinaculum can also be identified in this image. This is an image of the flexor retinaculum here. It's also called the transverse carpal ligaments. In case you see that, so you can call it transverse carpal ligaments or flexor retinaculum, and it forms the roof. You notice some of the contents. We'll talk about the contents of the carpal tunnel in the next couple of slides. But you notice that some of the content tends to be tendons, and we have just one major nerve found in the carpal tunnel. What are the contents of the carpal tunnel? They include the tendons of the flexor pollicis longus, the tendons of the flexor digitorum profundus, and the tendons of the flexor digitorum superficialis. Please do remember that the tendons of the flexor digitorum superficialis are four in number. The tendons of the flexor digitorum profundus are also four in number, making eight major tendons alongside the tendon of the flexor pollicis longus, which is what we have a total of nine tendons found in the carpal tunnel. And the last structure that is not a tendon is the nerve, and that's the median nerve. So one nerve, nine tendons, making a total of about 10 structures in the carpal tunnel. So this image again showing us, aside from the boundaries, showing us the contents of the brachial plexus, and you can count at least 10 major structures found within the carpal tunnel. This includes the median nerve, which is the only nerve in the carpal tunnel, and then the nine tendons that are gotten from different structures. We have the four tendons of the flexor digitorum profundus, four tendons of the flexor digitorum superficialis, and one tendon of the flexor pollicis longus. The last important space of the upper limb is the anatomical snub blocks. This is a triangular groove found at the radial aspect of the dorsal wrist. It is the prominent space that occurs or that is seen on extension and abduction of the thumb. The boundaries of the anatomical snub box includes the lateral medial boundaries. Boundaries of the anatomical snub box is formed largely by the tendons of the extensor pollicis brevis and tendons of the adductor pollicis longus. I'll show you a picture of how it looks like. Medially, the is formed by the tendons of the extensor pollicis longus. So remember that the brevis, extensor pollicis brevis, and pollicis longus, adductor pollicis longus are forming the lateral boundaries, and the extensor pollicis longus forms the medial boundary. Please don't confuse this because they could always trick you into thinking that Logos is forming the lateral boundaries, whereas Purpose is forming the medial boundaries. It's the other way around. The roof and the floor of the typical snout box are formed by multiple structures. The roof is formed by skin and superficial fascia. The floor, whereas, is formed by the carpal bones, the carpal bones on the lateral side, which includes the scaphoid and the trapezium. This is an image of the anatomical smallpox. As you can see, it's a triangular structure just directly on the dorsal part of the thumb. And you notice the different structures forming the boundaries. You have the extensor pollicis longus forming the medial boundary, and then the um, adductor pollicis longus and extensor pollicis brevis. These two muscles here, tendons, they are forming the lateral boundary. And then in between, you have the stump box just sitting down there, covered by skin, superficial fascia, and beneath that, you have the scaphoid bone and trapezium somewhere around here. What are the contents of the anatomical stump box? This includes branches of the radial artery, radial nerve, and proximal end of the cephalic vein. Besides the axilla, the cubital fossa, carpal tunnel, and the anatomical snowflakes, we have some other species that are worthy of note. They are not really high yield species to know about, but they are species that you should just know just by virtue of learning anatomy. This includes the quadrangular species, the upper triangular species, and the lower triangular species. These three species are found at the scapula. They're found at the back of the shoulder. Uh, if they're given to you in your slides, please do learn them, learn the boundaries and their contents, but typically, are not questions that they would ask you in your in-course or in your essays in prose. Another space that is also worthy of notice is the Gugnion's Canal. This is also called the Ulnar Canal. This is a space that is found directly at the wrist. It's a space that we tend to also see very close to the carpal tunnel. What's important to note about the Gugnion's Canal is the fact that it carries the ulnar nerve and the ulnar artery. So damage to the Gugnion's Canal could lead to problems with the ulnar nerve and ulnar artery. That can present as a claw hand. Let's talk quickly about clinical significance of the species of the upper limb. This would include things like axillary node clearance, vein puncture, intravenous injection, blood pressure measurements, the carpal tunnel syndrome, and the scaphoid or fractures. Starting with the axillary lymph clearance, because of the fact that we have axillary lymph nodes present within the axilla, whenever there's a breast tumor or cancer, aside treating the breast cancer, one other thing that we tend to do is that we tend to get access to the axilla to remove the axillary lymph nodes. And this is a procedure done usually together with a mastectomy. This is just important to note because of the location is one of the species that we mentioned. That's the axilla, and the contents present with there, the nodes there are very significant in draining lymph nodes, in draining lymph fluid rather. When we stop talking about the lymphatic urine of the upper limb, we need mention to this again and talk about the importance of the axillary lymph node in terms of the drainage of breast lymph. Another very important clinical significance is venipuncture. Remember that venipuncture is typically done at the cubital fossa, which is one of the species that we talked about. This is because that the roof, one of the contents of the roof of the cubital fossa is the median cubital vein. And the median cubital vein is the commonest site of venipuncture. Intravenous injection as well will also be given at the cubital fossa because of that median cubital vein. In terms of blood pressure measurements, we tend to measure blood pressure using the auscultation or auscultatory method by placing a stethoscope on the cubital fossa to listen to the coracough sounds. So this is just important. So venipuncture, intravenous injection, and blood pressure measurements are all different clinical applications that we can tag together with the cubital fossa. All right, in terms of the carpal tunnel, what very important thing to remember about the carpal tunnel is the condition we call carpal tunnel syndrome. So because the carpal tunnel is a space and is a space surrounded by different structures alongside the boundaries, that space will start becoming closed in different conditions. People that are typists people that make use of their hands or wrist at multiple periods of work could have people that are obese could have a reduction in that space. And what is the reduction in the space of the carpal tunnel? That can lead to compression of the nerves, particularly the median nerve found in the carpal tunnel. And the compression of the median nerve is the most important clinical significance of the carpal tunnel syndrome. I'll talk about that when I show you pictures of carpal tunnel syndrome and then the symptoms that we see as a result of compression of the median nerve. Then the scaphoid fracture typically occurs. Remember that scaphoid bone is part of the floor of the anatomical small box. So one way that we can test for scaphoid fracture is by palpating the anatomical small box by, by extending and abducting the tongue and checking for those fractured parts of the scaphoid. So this is just a picture showing us the measurement of blood pressure around the cubital fossa. Remember that for us to measure the blood pressure, we would apply the cuff just directly above the cubital fossa on the arm, usually on the middle one third or upper one third of the arm. Then we inflate the cuff and place our stethoscope at the cubital fossa to listen to the coracle sounds. And by this, we should be able to get the systolic and the diastolic blood pressure of the heart. This is an image of venipuncture. This is done in taking blood samples from the medial cubital vein. Remember, the medial cubital vein is one of the structures of the roof of the cubital fossa, and as a result, venipuncture typically occurs at the cubital fossa. This is an image showing us the carpal tunnel syndrome. This is what happens when there's a compression of the median nerve as it's passing through the carpal tunnel. The symptoms we see in carpal tunnel syndrome tend to be symptoms associated with the median nerve palsy. And what tends to occur, first of all, is that because the median nerve supplies the senior muscles are muscles supplying the thumb, there will be a loss of function of the thumb. Usually, how we know that there's a loss of function of the thumb is that in carpal tunnel syndrome, due to the damage of the median nerve, there will be an inability to oppose the thumb. Opposition is the ability of the thumb to touch the other fingers, and that's lost as a result of carpal tunnel syndrome due to median nerve damage. Another side effect or another symptom that we see in a carpal tunnel syndrome is loss of sensation or abnormal sensation at the areas supplied by the median nerve, the skin areas supplied by median nerve. And this image shows us the areas supplied by the median nerve. The median nerve tends to supply the palmar part of the hand from the thumb, the pointer, the middle finger, and the one half of the ring finger. So we usually say that the median nerve supplies the lateral 3.5 digits alongside the palm, the half of the palm, um, and the senior eminence. So these are the areas supplied by the median nerve, and these areas will become numb or will have an abnormal sensation of pain due to damage of the median nerve. And that concludes our module on the species of the upper lip.